Hello and welcome. Today we're going to discuss a rare but important condition called Tegmen Tympani Defect, which can lead to a cerebrospinal fluid, or CSF, leak into the ear. This may sound complicated, but we'll break it down to understand what it is, why it happens, and how it's managed. So, what causes a Tegmen Tympani defect? In many cases, the exact cause is unknown. We call that idiopathic. However, several factors can contribute. These include congenital thinning of the tegmen tympani, which is the bony roof separating the middle ear from the brain. Trauma, such as a head injury, can fracture the tegmen. Chronic ear infections, particularly those that erode bone, can also weaken the area. And finally, certain surgical procedures involving the middle ear or mastoid can, rarely, result in a defect. Let's delve into the pathophysiology. The tegmen tympani is a thin plate of bone that forms the superior border of the middle ear and mastoid cavity, essentially acting as a barrier between these air-filled spaces in the cranial cavity above. When a defect occurs in this bone, it creates a pathway for cerebrospinal fluid, which normally surrounds and cushions the brain and spinal cord, to leak into the middle ear. This leak can then travel down the eustachian tube and out of the nose, or it can accumulate in the middle ear, leading to a variety of symptoms. Tegmen tympani defects are relatively rare. Accurate estimates of their prevalence are difficult to obtain because many cases may go undiagnosed. They can occur at any age, but some studies suggest a slightly higher incidence in middle-aged adults. The rarity of the condition means that it's often not considered as a first-line diagnosis when patients present with symptoms like ear drainage or hearing loss. The signs and symptoms of a tegmen tympani defect leading to a CSF leak can be quite varied. The most common symptom is clear fluid draining from the ear, known as otorrhea. This fluid is often described as salty or watery. Other symptoms may include hearing loss, tinnitus, or ringing in the ears, a feeling of fullness or pressure in the ear, dizziness or vertigo, and in severe cases, meningitis, which is an infection of the membranes surrounding the brain and spinal cord. It's important to note that these symptoms can also be caused by other, more common conditions, so a thorough evaluation is crucial. Diagnosing a tegmen tympani defect requires a careful approach. An audiogram can assess hearing function. High-resolution computed tomography, or CT scan, of the temporal bone is typically the first-line imaging study. This helps to visualize any defects or thinning in the tegmen tympani. In some cases, a magnetic resonance imaging, or MRI, with contrast may be necessary to further evaluate the area. A beta-2 transferrin test can confirm the presence of CSF in the ear drainage. This test is highly specific for CSF, making it a valuable diagnostic tool. While we don't typically categorize tegmen tympani defects into distinct types, they can be described based on their size, location, and etiology. For example, a defect may be described as small or large, located in the anterior or posterior tegmen, and caused by trauma or chronic infection. Understanding these characteristics is important for planning the appropriate treatment approach. Treatment for a tegmen tympani defect aims to repair the defect and stop the CSF leak. The primary treatment option is surgery. This may involve either a middle fossa approach, where the surgeon accesses the defect from above through the skull, or a transmastoid approach, where the surgeon accesses the defect from behind the ear. The defect is typically repaired using a graft, which may be made of bone cartilage or synthetic materials. In some cases, a lumbar drain may be placed to divert CSF and promote healing after surgery. Conservative management might be considered in very small defects where the leak is minimal, but this is rare. Preventing tegmen tympani defects can be challenging, especially when the cause is idiopathic or congenital. However, minimizing the risk of head trauma through protective measures, such as wearing helmets during sports or in hazardous work environments, can help. Prompt treatment of ear infections and careful surgical technique during ear procedures can also reduce the risk of iatrogenic defects, which are those caused by medical intervention. The prognosis for patients with tegmen tympani defects is generally good with appropriate treatment. Surgical repair is often successful in stopping the CSF leak and resolving associated symptoms. However, there is a risk of recurrence, so long-term follow-up is important. Recent research is focused on improving surgical techniques and developing new grafting materials to enhance the success rate of repair. Furthermore, advancements in imaging technology are allowing for earlier and more accurate diagnosis of these defects.